All right, just giving folks a chance to get connected. So without too much further ado, let me introduce our speaker for today. Oh, I should have said I'm Jen Ahern, Associate Dean for Research and Executive Associate Dean. Usually Lauren Goldstein hosts the seminar, but today she's attending a training on ARPA-H funding, so I'm stepping in. So it's nice to see you all here. I'm very pleased to introduce our speaker today. Today's talk will be given by Khadijah Ameen. She is a community-based social scientist and public health practitioner who has over a decade of experience integrating racial health equity solutions into research, policy, and practice. She's a postdoctoral scholar here at the Berkeley School of Public Health in Community Health Sciences, and her research explores barriers and opportunities for building the civic power of Black women, particularly those in the American South, to shape equitable health policy change. She has been involved very directly in a bunch of really interesting policy-related efforts. She's co-founder of the Georgia-based nonprofit Black Health and manages the organization's community health research advisory and policy advocacy work streams. And she also, in the past, provided strategic advisory to the federal government on integrating evidence-based policy interventions into health and social policies at CDC's Office of the Associate Director of Policy and Strategy and CMS's Innovation Center. So I think with that background, we're all really interested to hear what you're going to share with us today, Khadijah, and that the title is The Politics of Empowerment, Advancing Black Women's Civic and Population Health. So I will hand it over to you, and very, very excited to see what you have to share with us today.
Yes, thank you so much. And happy to be in this virtual space with you all today. I have like a two-screen setup, so as I'm presenting, please feel free to drop anything in the chat, and I apologize if I miss anything, but we'll have some time at the end to chat as well. And I will start presenting and share my screen. All right, are folks able to see my screen?
Looks great.
Awesome. Well, thank you all. Really excited to be here today. As Jennifer mentioned, my name is Khadijah Ameen. I am a current postdoctoral scholar in the School of Public Health, Community Health Sciences Division, and really looking forward to sharing some of the work that I'm really passionate about that I also have like embodied experience around. So yeah, looking forward to this brown bag. And I wanted to start the conversation with why this talk is focused on the US South and my own just personal connection to the South. So the image that you see here on your screen is of the US South Black Belt, which W.E.B. Du Bois describes as a strange land of shadows. So named for both its Black fertile soil and its Black people, the South is the stopping place of the transatlantic slave trade as the location of many of America's port cities and where chattel slavery served as the economic engine of the United States. Today, we see the afterlives of the slave trade through the population of Black folks that still reside in the South today. So, over 50% of Black people, including over 50% of Black women, still reside in the Southeast, more than any other region of the United States. And this geographic location is also where I am based out of. I grew up in Virginia, the home of the Confederacy, and spent my entire adulthood in Georgia. And as a someone who identifies as a Black woman, I have firsthand experienced the impacts of political disenfranchisement in the South, particularly in Georgia, on my own reproductive rights and access. So this is both a critical topic where there are lots of inequities, but also something that I am personally connected to. So I want to start just with some commentary around Black women's political exclusion, again, particularly in the South. So throughout history, Black women, Black Southern women have faced intersecting forms of civic disenfranchisement, facing both classism and racism and sexism um, as barriers to full participation as citizens in democratic processes. Historically, Black women in the South have faced systematic political exclusion, including through, again, that denial, that non citizenship during the antebellum period. Following the Civil War and Reconstruction, Black women still and their families still face racial terror, poll taxes, literacy, impossible literacy tests, grandfather clauses when attempting to exercise civic participation. And Black women were largely barred from women's suffrage movements. We hear 1920 a lot in terms of women's right to vote, but despite the 19th Amendment in 1920, Black women did not legally gain the right to vote until the Voting Rights Act of 1965. And today, we see the legacy of the civic disenfranchisement in contemporary, often race neutral forms. Despite representing a critical and consistently high turnout voting bloc in the United States, despite being heralded as democracy savers, Black women across the South live in repressive political and policy environments marked by um, disenfranchisement, various forms of civic and voter suppression, restricted health rights and autonomy, and barriers to accessing vital healthcare and social services. Black women are also significantly underrepresented across political leadership, both in the South and across the country. So we make up only 3.4% congressional seats, under 2% of top 100 mayoral positions, and only 5.4% of state legislative seats. So we're still also facing those inequities in political leadership as well. So as I mentioned, I am based in Georgia, so wanted to uplift some of the Georgia context and some of those barriers around both civic engagements, participation infrastructure, and reproductive health. So as it relates to civil and voting rights, Georgia, alongside Alabama and Mississippi, are is one of three states that lacks a comprehensive state-level civil rights act, which leaves everyone in our state, including Black women, with limited state level protections against various forms of discrimination in healthcare and housing and employment and public accommodations. Uh, this legislative session, which Georgia's state legislative session just ended April 2nd, but we will likely end up going into a special session because of voter rights. We saw state legislators introduce bills attempting to derail our election system in a year where Georgia and the country, but especially Georgia, is playing a critical role around elections. So this has looked like an attempt to hastily move to a paper ballot system. There was a state level version of the SAVE Act that was introduced in the Georgia State Legislature. And then there was a Georgia nonpartisan bill that passed both chambers um, that is only focused on the 5 metro Atlanta counties and certain elected positions. And it's essentially a power grab for those counties that have both the highest percentage of Black residents in Georgia and the most Black political leadership in Georgia. So those legacies of voter suppression still exist today in Georgia. And then when we look at those political um, hurdles, barriers to our reproductive health and rights and autonomy and access, Georgia, along with several of our southern peers, is still a Medicaid non-expansion state. Georgia has a 6-week fetal heartbeat bill, essentially a total abortion ban on the books after the fall of Roe. And there are several tactics at both the state level and local level that Georgia has been implementing since the pass of that total abortion, almost total abortion ban to surveil and criminalize birthing people as well as healthcare providers that are in need of vital reproductive health services. So when we think about population health, this has implications for reproductive health outcomes. So on the screen here, I included 2 maps that do look pretty similar to that map I showed at the front of the US Black Belt regarding infant mortality rates as well as perinatal mortality rates in the United States. So Black women in the southern US experience significant reproductive health inequities, including disproportionate prevalence of maternal mortality and morbidity, preterm birth and infant mortality, and higher rates of HIV and sexually transmitted infections compared to both other racial ethnic groups in the region and nationally. For example, in my home state of Georgia, our maternal mortality rate is among one of the worst in the country, with 33.9 deaths per 100,000 live births. And similar to the rest of the country, these numbers are worse for Black women. So in Georgia, Black women were 48.6 pregnancy-related deaths per 100,000 live births experienced to compared to 22.7% of pregnancy-related deaths experienced among non-Hispanic white women per 100,000. Our experiences are more than biostatistics and data. There are real world implications for political disenfranchisement and across our region, and this impacts real people. Amber Thurman, Candy Miller, Adriana Smith, These are Black women, mothers in Georgia who all died preventably from Georgia's near total abortion ban. And I believe it's critical that we continue to uplift and name these people, these women, their families, when we and as we continue to fight for reproductive justice. All right, so now we'll transition to civic health, civic power, and Black Southern women's role in advancing health justice. So the title of this presentation is The Politics of Empowerment. And this title I borrowed, uplifted from Black feminist sociologist Patricia Hill Collins. This really is a connection to just a rich history of Black feminisms, and really connects to Black women's critical role in political action. So I pulled some quotes that African American women's political action provides an alternative analysis of power and politics to white, male centered political um, forms of inquiry and understanding. Black feminism constitutes an important case for studying how a subordinated population continues to empower itself within the US context of domination. So, throughout centuries, Black women, because we have been impacted first and worst by intersecting forms of oppression and domination, and have firsthand familiarity with the health and social problems that our fields grapple with today, have that experiential knowledge and wisdom and experience with uh, creating and recasting ideas, and testing and revising forms of social action to improve outcomes for all. And I also want to really uplift the fact that despite being a site of domination and oppression, the South is also a site of intersectional resistance. On the left is an image of Ella Baker, who was one of the leaders of the Mississippi Freedom Democratic Party and a, a godmother of so much critical civic power efforts across the country. And on the right is an image of the voting rights group, Black Voters Matter. He was co-founded by LaTosha Brown and has deep roots in the South, and really playing a critical role in civic, advocating for improved civic infrastructure and protection and efficacy. Going back to Black feminist thought, something that is important lens to consider when talking about civic engagement and participation in health is moving beyond a focus on those, again, white-centric framings of citizenship and participation and democratic involvement. So one way to make that shift is from moving from those single issue political struggles. So core to Black feminism is the idea of multi-issue struggles, that systems of domination are complex and impact various people um, across modes. And so um, calling for that critical focus on multiple issues. This also relates to the Black feminist idea of flexible political solidarity, so that um, solidarity can be exercised and adapted across social movements. Also, using a Black feminist lens to think about civic participation and power moves us beyond thinking about the individual as a unit of civic participation. So, moving beyond thinking about individuals as constituting the primary social actors and centering efforts around personal advocacy, around one's own interests. And so this movement looks like um, focus on political engagement at the community level, as well as addressing versus individual determinism, moving up to um, critiquing and improving our democratic institutions and that civic infrastructure. And then lastly is the call for a focus on beyond representation in token roles within dominant government institutions and really thinking about community work and coalitional work and that care work or mother work that Black women have been engaged in for centuries. And here I wanted to break down a bit that connection between civics and population health and this concept of civic health. So, civic health comprises of multiple different facets. It's beyond, again, individuals voting or participating in civic processes. It really looks at the totality of opportunities, pathways, breaking down barriers for full civic engagement, as well as civic leadership. It looks at communities again as a site of identity and an item of empowerment as a means of uh, shaping uh, future community health improvements. It looks at civic infrastructure. So, again, looking at institutions and how we can ensure that at the institutional level, there are policies and practices in place that support um, political and civic engagement of communities. And then it looks at efficacy. So, the ability of communities to fully engage in decision-making processes around our health and well-being through increased awareness and skills and that community determination to impact change at the local and state level. So I wanted to uplift some examples of the work that I've been involved in Georgia around civic power that is really rooted in that intersectional reproductive justice praxis. So one is work that I have been connected to through Spelman College and the Georgia Women's Policy Institute. This is a policy institute that is focused on building that civic efficacy of women of color across the state of Georgia to directly inform policy change. So, as part of that civic capacity building, the fellowship equips women of color across the state to understand, not just understand Georgia's civic process, but directly work with existing policy leaders, both that hold elected elected positions, as well as civic leaders on the ground at community organizations to define and create a policy, a state policy agenda, and then work with those partners to both introduce policies and work those policies through our state legislative process. So, an example of some policy work that we've been doing and we've had wins around include protections for domestic violence survivors in Georgia to ensure that women who have experienced domestic violence um, are not penalized by our carceral system for engaging in modes of survival. I am also involved with 9 to 5. They are a national worker justice organization that has chapters across the United States. And I am a part of their Georgia coalition. And so through that coalition, we have been involved in advocating for worker justice issues that directly impact working women across the state, including fighting for paid leave, fair wages, and anti-workplace discrimination policies. And we've also, through those efforts, have been able to have policy wins around, Georgia does not have comprehensive paid leave yet, but we have made some progress in terms of expanding paid leave access for public workers in the states. Through the Georgia Swim Policy Institute, we have been working in partnership with Women on the Rise Georgia, which is an organization that is founded and led by justice impacted women across the state. And they have been critical in various forms of voter rights advocacy to counter both felony disenfranchisement, but also those, again, infrastructure barriers to um, justice impacted women being able to vote, even when they do on paper have the rights to vote. So they do a lot of voter education in jails and with women who are on probation around rights as it relates to voting. And then lastly, I want to uplift, amplify Georgia Collaborative. They are a collaborative of reproductive justice organizations across the state of Georgia fighting for reproductive justice. And as part of that collaborative, I've had the privilege of supporting some of their work at the Georgia Legislative Capitol, Georgia Capitol this year. So we held 2 reproductive justice days, one focused on advocating for the Reproductive Freedom Act, which is a piece of legislation that would undo our near total abortion ban. And the other action we did was a Righteous Rage Day of Action, where alongside the mothers and sisters of Amber Thurman and Candy Miller, we went to the state capitol and held a silent action, a silent funeral procession to hold our legislators accountable for the abortion ban. We are also involved in decriminalizing pregnancy work and have a campaign going on this year to target city councils and county commissions around exercising their um, political power to safeguard women from the and birthing people from our state level abortion restrictions. I also wanted to connect this work to some of the research that I am starting to build out at Berkeley as a postdoc. This is a pilot project that recently got funded through our population center, focused on harmful state preemption and the impacts on family planning decision making of Black working mothers in Georgia. So I had mentioned earlier that one of the contemporary forms of race neutral civic disempowerment and disenfranchisement is through harmful state preemption. So that is when at the state level, a state supersedes or overrides local level decision making. And that has implications for a variety of different local policy issues in the context of what I'm doing my research on are the implications on worker justice issues, particularly as it relates to paid leave, so localities' rights to enact uh, comprehensive paid leave above the state, as well as fair wages and increasing the minimum wage and comprehensive child care. So, as part of this research effort, I will be interviewing Black working mothers living across the state of Georgia to understand how that harmful state preemption has impacts on reproductive health decision making and outcomes. So, from family planning decisions to maternal stress, and hoping that this research, in partnership with some of the community orgs I'd mentioned before, can both uplift those counter stories of Black working mothers around that connection between civic disenfranchisement and reproductive health to various decision makers, but also inform state and local level policy change. And I'll be presenting more about this study on Friday at the BPC conference. So lastly, I wanted to end before jumping into any Q&A with why any of this matters to us in public health. And as we, as a field, are grappling with our engagement in and with politics. So since over the past year and some change, we have observed an increase in public health practitioners and researchers getting politically involved and raising our voices around that connection between policy and politics and health, particularly in the way that politics impacts us as individuals and as an institution and our workforce. And so, really part of where I hope to see the field continue to grow in is that engagement with politics and policies as it relates to impacts on the health and well-being of the um, individuals and communities that we are doing our research on and with. So beyond our own institutional preservation. And this is in alignment with the direction that health equity research and practice is really calling the field to go towards. It's in alignment with our increased understanding of the role of policy decision making, of laws and legislation ordinances in impacting our population health outcomes. So, yeah, I want to just make that call, and I hope, I know there's some students in this virtual space as well. So, um, politics and policies directly impacts our health and well-being, and um, the more that our field can make that connection and get involved in that praxis, the better. So awesome. I will stop here. And I know we have a few minutes if there are any questions or comments or thoughts. I have my contact information on the screen, but I'll actually stop sharing and just drop this in the chat so we can discuss more.
Thank you so much, Khadijah. That was a fantastic talk. I imagine folks are going to have questions, comments. Feel free to put your little Zoom hand up, or you can put questions in the chat. Maybe I will start with something that I found interesting in your talk. So I've been thinking a lot lately about a concept you put in one of your earlier slides on flexible political solidarity. And there have been some sort of collaborations between public health and some folks who identify as being part of MAHA, where there is sort of, overlap in sort of how we see things. And I've been having just very mixed feelings about that and trying to think like obviously making bridges where there so that people can really communicate and find where there is common ground seems positive, but then the detrimental impact of some, at least elements of what Maha has been doing feel obviously problematic. And I don't know, I just wondered what your reflections were on being flexible and how you balance sort of whether you feel like you're doing net positive or net negative in those efforts.
Yeah, I appreciate that comment. And also, I've been thinking about flexible solidarity a lot as well over the past year. One of the key concepts or parts of flexible solidarity through that Black feminist lens is the idea and that shift from being in solidarity solely based on socially constructed identities and moving towards solidarity based off of aligned values and principles. And I think that could be just a helpful way to think about public health engagement again with politics and policies. And so just having a strong and aligns grounding in various anti-racism, liberatory frameworks and praxis um, will help with some of that decision making around like when and how to flex one's political engagement.
Yeah.
So, yeah, I think I honestly would like go back to um, uh, that like the theories and thoughts and lenses around liberation as a tool, as a guide for decision making around that.
Thanks for that. All right, public health folks, I know you have questions and comments. Don't be afraid. And thank you. I see you there.
Hi, Khadijah, thanks so much for this. This isn't a very well-formed thought, but I remember reading something um, a couple of years back that was written by somebody who was in Texas and was reflecting on COVID. And one of the things that I was really struck by, and if I recall this correctly, this woman was a physician, and she was portraying sort of coastal public health elites as being really disengaged from the American South, and particularly from health disparities experienced by people in the American South. And it struck me as strange because I don't think of, I know public health sort of through the Berkeley lens, but wouldn't characterize Berkeley public health as unaware of health disparities, and particularly how they play out regionally, or unconcerned. And so I don't want to give too much weight to this one particular person's op-ed that I read a few years ago, but I was wondering about, like, to what extent would you say that that person's characterization, it rings true, that people living in the American South, particularly people who are suffering from health disparities, feel like public health isn't on their side, or is willing to forego progress in the South just because, red states are a lost cause or something. And if that is sort of how people are experiencing public health, then do you have suggestions about how to bridge that? So it does the characterization ring true? And if it does, then what might be a response, especially for those people who might think that's not how I feel about health disparities, or that's not how I want to be oriented around what we're seeing in terms of health disparities, especially their regional impacts.
Yeah, no, I definitely resonate with that, and feel as someone who is both newer to California and like learning California's context, but still rooted, based in Georgia, have been thinking about that a bit. And um, something that comes to mind is some recent data that has shown that um, maternal health providers and like our future workforce are making decision making around where they'll be doing their residency programs, where they'll be practicing based off of our differences in oppressive political environments when it comes to reproductive health and rights. And while I certainly understand that decision making, especially when we think about providers that are also birthing people and have families and are thinking about their own abilities to live in quality of life. I get it. I also am feeling like this like sense of abandonment when like people both try to pull out vital uh, health promoting resources, including like people from the South. Um, and also, like, I always just come back to the fact that Black folks are still here, like, regardless of various forms of migrations, inter-US migrations to California and to other northern cities. Like, we're still both physically here, our communities are still creating and living and working through various counter practices to survive and thrive down here in the South. But yeah, I think that this like abandonment and like looking down on efforts in the South, yeah, it is disappointing. But also what I see as I'm getting more involved in some community work in California is just how much the roots of reproductive justice movement and liberatory civil rights efforts from the South are and have like sprouted and gone to places like California and cross country and transnationally. So um, yeah, I also think about that with your question.
Thank you. We have a question coming in the chat from Nia. Do you have tips for leveraging our status as public health students to support liberatory civic engagement efforts?
Yes, yeah, absolutely. So, um, and this reminds me of I taught yesterday, guest lectured Dr. Keller's class yesterday on community engaged research, and something we talked a bit about was just first starting inward and engaging in a reflexive process of understanding one's own social location and paradigm orientations and experiences and how that influences the research and practice you do. Really like from a strengths-based lens, I would say like leaning into your like unique positionalities to engage in research and policy and practice that um, directly impacts the communities, wherever that means for you, that you're from. I also definitely encourage folks to tap into state and local level coalitions on whatever issue that you are engaged in to better understand their priorities and how you can be supportive of that versus the other way around. There for any particular issue that you're passionate about, that you're studying in school, there are groups that have a long history in that on the ground context of attempting to tackle that issue. So I would say connecting to that. And then the last piece I would encourage is that political education both outside of and beyond just traditional public health um, texts that we read. And so engaging with transdisciplinary and non-academic literature and whatever topic you're interested in and how it connects to social justice, but also staying connected and informed around local and state level policy and political actions. I'm still very, I'm a big fan of like public media and like NPR. And whenever I'm driving, I really try to, or yeah, whenever I have the space and time, try to listen to, absorb, read, stay informed around like local and state level policy happenings and how my research areas of interest can potentially plug into that. So, yeah, staying informed, joining coalition, and looking inward, I would suggest.
Wonderful. Well, thanks so much, everyone, for your engagement. And we're just about at time. So thank you again, Khadijah. This was a wonderful talk. Lots of little clapping virtual hands. I hope you can see them on your screen. Um, but yeah, I hope everyone has a great week and thanks for joining the seminar.
Thank you.